Hello, welcome to my channel. My name is Nurse Pauline. Today we'll be talking about loss, grief and dying. Hope all is keeping well. Before we get started, please hit your like button, hit your subscribe button, and please share my videos. There are various kinds of loss or grief due to death, divorce, loss of a body part, loss of a job, losses due to disasters, losses of homes due to fires. There are psychological loss and physiological response to loss. Anticipatory grief. There are patients with chronic illness, terminal diseases. Grief is the internal meaning given to the experience of loss. Mourning is when grief you have on the inside is expressed outside of yourself. Bereavement mourning is the adjustment time taken following the loss of a loved one. Complicated grief is delayed grief, unhealthy grieving, maladaptive reaction, grief lasting greater than 6 months, prolonged grieving, suicidal ideation, unable or cannot function. A psychological loss, example, loss of a body part, breasts, legs, eyes, arms, loss of hope. Kubler-Ross stages of grief and dying. The first stage is denial, disbelief, shock, and helplessness. The second stage is anger, guilt, sadness, isolation. The third stage is bargaining. The patient expresses guilt and fear. The fourth stage is depression. Patient is grieving at what has happened. The fifth stage is acceptance. The patient has come to terms with illness. Persons can go back and forth from one stage to the other. Note, everyone goes into all stages. Some people do not go into all stages. Some people will choose at what stage they need to be in. Factors that influence his response to grief. These factors are developmental level. Older adults have experienced more deaths. Psychosocial, spiritual, cultural, socioeconomic states, support systems, depression, personal relationships, nature of loss and trauma. Nurses' response to dying patients and family. Nurses should listen to patient and family, empathize with the family and the patient, use therapeutic communication, use silence, listen, allow patients and family to verbalize feelings of loss. Assess sleeplessness, assess decreased depression, assess loss of appetite, assess anxiety, pain, suicidal ideation, assess fear, assess decreased concentration, assess need to see a pastor or a clergy. Allow patient to participate in his or her own care. Allow empathy, trust, caring. It's okay to cry with family and patients. Put yourself in your patient's and family's position. Allow for the family space, time to grieve and connect. Decrease the noise level. Encourage patient and family to talk with each other. When it's close to death, encourage the family to continue talking with the patient because the hearing is the last to go. Educate the family concerning the stages of death. When it's near death, patients will have decreased appetite, difficulty swallowing. Some patients are nothing by mouth, NPO. Some patients will have mottled skin, blue and purple patches on the arms and legs. Patients may become incontinent. Urinary output will be less than 30 cc's an hour. Patient will experience labored breathing, chine stroke with apnea, confusion, decreased level of consciousness. Sign of imminent death is dilated fixed pupils. At the time of death, ask the family if they need the patient to have the dentures replaced in. Sometimes the patients are going to have a funeral or a viewing. We will have to put the dentures in. Ask the family if they need to speak with a pastor or a clergy. Nurses will administer pain medication IV. Usually we do drips for patients to make them comfortable. When patients die, we have to have the exact time of death. So nurses need to keep doing rounds with a patient who is dying. If the patient is alone, please continue doing frequent rounds. A patient do not have to die alone if there's no family at the bedside. But if the family is not there, usually the family can tell us the exact time. But if the patient is there by him or herself, we have to know the exact time. I think the doctor may have to put the time on the death certificate. When the patient has died, we call the doctor immediately to come and sign the death certificate. The doctor is the one who pronounces the patient as being dead, not the nurse, so you have to call the doctor. The doctor has to come immediately, tell them you have to communicate with the organ donation bank not greater than an hour. It has to be done within an hour of death. The organ donation forms are located on the unit, the nurse's unit. The nurse completes the organ donation form called the organ donation within an hour. Do not communicate anything about organ donation to the family. It's not the responsibility of the nurse. The organ donation bank, they will call the patient's family. They will get in contact with the patient's family. Palliative care is approved. Palliative care and hospice care can be started in the hospital. Then the patient will be discharged home or to a hospice facility. Palliative care is an approach that improves the quality of the patient's lives and families facing life-threatening illness through prevention of suffering for patients with chronic diseases. They offer physical and psychological and spiritual support to families and patients. Palliative care begins with a diagnosis at the same time as treatment is also beginning at that time of diagnosis. Palliative care neither hastens nor postpones death. They're there to provide comfort to the family and the patient and make everything a smooth transition. Palliative care nurses provides pain relief. Hospice comes into play when the patient has less than 6 months to live. The patient could be in the hospital or maybe the patient is at home. Hospice nurse helps the families during the remaining days, also the patient. Hospice offers comprehensive, coordinative care to the family and patient. Hospice nurses helps with compassionate care for patients with terminal disease. Hospice care prioritizes in comfort, quality of life by reducing pain and suffering. The hospice nurses also administers pain and medications to make the patients comfortable. Okay, hope you enjoyed my video. Have a good day. Thanks for listening in. Please hit the like button. Please hit my subscribe button. And please share my video. Thank you. Have a blessed weekend. I'll see you on Monday, Eastern Standard Time in the afternoon. Thank you.